What if you had a perfect virtual copy of yourself? A digital twin that thinks, learns, and reacts just like you. At first, that sounds like science fiction. But digital twins are already here, used in medicine, industry, and even cities. And soon they may extend to you. A digital twin is a highly detailed virtual model of a real-world object, system, or even a person. The idea started in engineering. NASA pioneered it in the early 2000s, creating digital models of spacecraft to predict failures and test fixes without touching the real hardware. Since then, the concept has exploded. From wind turbines to jet engines to entire supply chains, digital twins let us simulate reality, spot problems early, and run what-if scenarios that would be impossible in real life. But here's where it gets really interesting. What happens when we apply this to humans? In healthcare, researchers are building digital twins of organs, like hearts and lungs, to test drugs, optimize surgeries, and predict outcomes before a patient ever enters the operating room. The European Union has a project called Destination Earth and another under its Human Digital Twin Initiative, aiming to create full-body simulations, updated with your personal health data. Imagine your doctor running treatments on your twin before ever prescribing them to you. And beyond medicine, companies are working on cognitive twins, models that learn from your behavior, choices, and personality. These could act as digital assistants or even carry on parts of your work while you're offline. Think about the practical uses. In fitness, your wearable devices already track steps, heart rate, and sleep. A twin could predict your risk of illness or fine-tune training for peak performance. In mental health, a cognitive twin could help monitor patterns in mood and speech, flagging early signs of stress or depression. In cities, a twin of you might interact with digital twins of transport systems, energy grids, or workplaces, optimizing how you live and move in urban environments. This isn't just about convenience, it's about deeply personalized living. But here's the flip side. If your twin holds intimate health data, emotional patterns, even decision-making logic, who controls it? Could insurers use it to deny coverage? Could employers demand access to optimize workplace productivity? Could your twin live on after you, making decisions you never approved? As with any powerful technology, the promise is huge, but so are the ethical risks. Looking ahead, we could see several paths. Medical transformation. Personal digital twins become standard in healthcare, catching diseases years before symptoms appear. Workforce shift. Twins handle admin, testing, and even negotiations, freeing humans for creativity. Identity shock. If your twin knows you better than you know yourself, does it become you or something else entirely? The line between physical and digital self could blur, forcing us to rethink what it means to be real. So digital twins could be the ultimate tool for prediction, prevention, and personalization, or the ultimate invasion of privacy. The technology is here. The question is, are we ready for our virtual selves? Every system has layers, and we're here to uncover them. Subscribe to Tomorrow Today for more deep dives into the tech and choices shaping our world.